Okay, so we're going to talk about testicular cancer, early detection and prevention. So, what is testicular cancer? It's pretty much a cancer found in males. It starts off as a germ cell which specializes in the testes, which helps produce sperm. There's two, there's different forms of this cancer, but the two main ones that we're going to focus on is seminomas and non-seminomas. Seminomas are less aggressive versus non-seminomas. They kind of grow more rapidly throughout the body and could spread out to different organs of the male. Risk factors could be, it can be genetic and it could be ethnicity. Caucasian is more likely to have it. If your brother has it, you're 8 to 10 times more likely. Also, if your father has it, you're 4 to 6 times more likely. So when it comes to signs and symptoms for testicular cancer, it's one of the things that it's not painful, so it kind of goes undiagnosed. So the male, you'll see like a lump on one of the testicles. It could be redness. You could have some heaviness around the scrotum area or on the lower back. Like aching pain around the scrotum or groin area. Like I said, majority of times, testicular cancer, that lump is not painful, so the male typically it's not too concerned about it, but if there is a mass or a lump on one of the testicles, it does need to be addressed. And it goes down to treatment options. There are different forms of treatment options. We have surgical removal of the testicle. May just remove one of the testicles so it can prevent from metastasizing. And like I said, there's different forms of the treatments when it comes down to seminomas, non-seminomas. If it is a non-seminoma cancer, that means that tumor could grow more rapidly and could have grown to different parts of the body. So you could follow surgery, removing the testicle, and then you could go into chemotherapy. You could also have your lymph nodes removed, but those are some of the treatment options for testicular cancer. Prevention and screening. So for the male, you tell the males after they take a hot, warm shower, they need to check each testicle, just to make sure there's no lump or nodule. They can do this at least once a month. Like the main thing is taking a hot shower for the testicles to go down to the scrotum, and then for them to go like in a circular motion on each testicle to make sure there's nothing new, no lump, no pain. So that's how to perform screening. Next, we have potential complications for testicular cancer. If it's not treated early, like I said, it could spread to other parts of the body. And that's when it comes down to being metastasized. Main thing is the metastasize, they're going to start feeling that lower back pain, and if they do go through the surgery, they could have fertility issues since they're removing some of the testicles, and they could also block us on that blood supplies, which will lead to less sperm. Next, we have community resources. Always contact the primary care provider. You also have the American Cancer Society, but always use your local resources. And as always ask your primary care provider, ask some questions for guidance. Next, we have just the in-class question. Starts teaching male client about testicular cancer and self-examination. What statement about the client indicates correct understanding? As an A, I should perform an exam before taking a shower. B, I would check for painful lump in my testicles. C, I would perform the exam monthly after a warm shower. D, testicular cancer is common in older males only. The answer to that would be C, because you want them to take a hot or warm shower at least once a month, and once they get out that hot warm shower, to check themselves. And it doesn't just have to be, like I said, it's for all ages of men. We focus on mainly between the 20 and 34-year-olds, but like I said, for all the males, they should at least do this at least once a month. And that wraps up my PowerPoint on testicular cancer.